Good morning, this is Dr. Badia. Welcome to Fixing Healthcare from the Trenches. This will be a weekly series every Thursday morning at 9 a.m. Eastern Time, where we will be discussing the major challenges being faced in healthcare delivery by all the outside powers, many of whom do not contribute a lot to healthcare. And then we wonder why we are twice as expensive as the next industrial country on the list of healthcare costs worldwide. So we aim to just at least bring awareness to the public. So our guest today, she'll be signing in momentarily, is Dr. Leah Houston. Dr. Houston is an ER physician, although she has, like many physicians, stepped away from clinical care to try to fix this problem. So we admire that. I know she misses seeing patients, but somebody has to do this. So we are going to be interviewing her momentarily. She is a SUNY grad, State University of New York, in biochemistry, very near where I attended my undergrad in upstate New York. And then she went to Albany Medical College. So she is a well-trained physician who did emergency medicine, and she practiced in New York City as well as in Long Island. She stepped away a number of years ago to found a company called HPEC. Hopefully, she'll be signing on momentarily. Do we have any feedback on that?
She's getting on. Just
Okay.
give her 1 minute.
Great. So she's going to explain to you what HPEC is. Basically, Dr. Houston is using blockchain technology to allow physicians and other clinicians to basically own their own credentials. So when they transfer from one hospital to a group, to a different type of facility, those credentials can go with them. After all, they're with them, and it shouldn't be this complicated process of asking for your transcripts from medical school or residency. It's unbelievable what we go through now. I'm about to bring on a colleague, and we're going to go through that. So hopefully HPEC will be well underway. So she'll be joining. Time I heard about blockchain, I a couple friends of mine are very into that. So she'll explain it.
There we are.
Hey, Dr. Houston.
I'm doing great.
How are you?
I had a little technical difficulty for the first couple of seconds.
Well, yeah, that's the irony, right? Sometimes it's the people who know tech best that have a stumble. And well, you're using tech, right, to really transform the way physicians can move between facilities and really a process that was totally antiquated. So can you tell us a little more about
HPEC stands for the Humanitarian Physicians Empowerment Community. And it's a digital physicians guild. And all of us as doctors are like, we need to unionize. We need to do what the nurses do. Well, we do. But a union is a structure that, it's kind of an antiquated structure, and there's new tools of digital coordination that allow for a much better process, a much more streamlined process where there's much more certainty over who's governing the organization. And those tools are decentralizing tools. And for those of you who hear the word blockchain in there, that's absolutely correct. And so, we have the ability to build a digital physicians guild through a DAO, a decentralized autonomous organization. And that's all based on decentralizing protocols that allow individuals to connect and govern themselves.
So we end up controlling our data rather than a union. I mean, I'm not going to get into that, but we know unions have their history. And instead, we don't want to all of a sudden transfer this control from big institutions, healthcare institutions, to a union, right? So physicians really need to be aware of this. So thanks for bringing that to light. So blockchain and really technology that we have will allow us to control our own destiny, and our own information, correct?
And, a lot of doctors are like, we're not allowed to unionize. I'm like, that's not true. There's actually physicians unions that exist. The Committee of Interns and Residents is a union of resident physicians. The union the Union of American Physicians and Dentists is a union that physicians are allowed to join. What we aren't allowed to do are the two things that make unions powerful, that make other unions powerful. And that is, we are not allowed to collude to price fix. And most doctors know this part. But the one thing that doctors aren't aware of, and intrinsically we are, because we know that we're not allowed to abandon our patients, but we're also not allowed to strike. At least we're not allowed to strike unexpectedly. If we ever wanted to strike as an organization, we would need to choose the date far in advance. It would need to be a very brief, hour-long, few-hour-long period. And we would need to let them know so that they could find staffing to cover for us. So the whole value that comes with being a union is not really valuable because we're not allowed to do the two things that give unions leverage.
Right. So unlike the air traffic controllers, right? So that's pretty important. I'm flying to New York to see patients, by the way. I will be running out at the end of this podcast to make my flight in time at MIA. But we know the problems that occur in that. And I think flying planes is pretty important. So physicians are always held to this higher standard, and that's okay. I think most of us are willing to accept that. But the time has come where doctors are really getting tired of being pushed around, and that's what this is all about. And I think, and I talk about this in my book, Healthcare from the Trenches. I say that many of these organizations really prey upon our altruism, right? They know that ultimately we're going to do the right thing. All right. And this is the big beef I have with insurance companies. And we're calling them out on it. And we're also inviting them to collaborate with us for a change. Hey, guys, talk with us. We want the same thing. And we know that you're in the business, let's face it, to make money. Okay. We live in a capitalistic society. We'll help you make money. So let us help you make it more efficient.
Absolutely.
So you started another company called
they're the
Evercred,
same company,
which is based partly. Okay, it is. Okay. So explain Evercred to us.
So there's two things that are going on. There's the guild, the Physicians Guild, the DAO, the Decentralized Autonomous Organization, the space that we can collectively organize, collaborate, and push up against the medical industrial complex. And then there's the credentialing system, the credentialing tooling that we've built. And Evercred is a credential issuing system. It's a decentralized identity protocol driven system that's an open standards-based technology that's going to be ubiquitously applied across industries for the future. And when I say that, every entity has some form of training or credentialing that it needs to do. And we have this nightmare of every 4 to 6 months it takes us to credential from the day we're hired until the day we're able to start working. And then we have to repeatedly do it every 2 years. It's crazy.
So the challenge is you're going to get insurance companies to use this, because you're right. If I'm bringing somebody on, hopefully at the beginning of the summer, and I have to start the process now, because it will take that long to simply get a provider number. I love that word, provider number. And, things work in nanoseconds now. So there's no reason for these things to take months. Am I correct?
And that's why, we're really excited about this new technology, because it's the only technology in existence that fixes that problem. And the way it does it differently from current credentialing systems is that every single credentialing solution that exists today is a downstream solution. Meaning after you've already gotten your degree, after you've already gotten your license, they try to make it a little bit more automated, a little bit faster to quickly check it. With the Evercred system or any other open standards-based decentralized identity credential issuing system, you're issued. Well, the reason I'm saying that is because I need people to understand that this isn't something I'm just building and hoping the world, uses. This is something that's being built and being used across industries already. And it's going to...
Absolutely. But healthcare is always behind, right? We are always behind
behind technology. And, it's time for us as physicians to frankly get our heads out of the sand and stop pretending like they're going to build solutions for us that are for us, because they're obviously not. It's time for us to build the solutions for ourselves.
For us, yeah. So, the problem is getting physicians to collaborate more. I talk about that in chapter 4. We are since the competition of organic chemistry, right? Sophomore year, we are trained to compete, and and the other parties in the healthcare megapolis know this, and they take advantage of that. So I think it's time now, with the ease of social media and so many other podcasts out there. The question is, will people, share this and discuss it together? Because otherwise, it's not. Nobody else is going to fix this for us outside. So speaking of fixing, can you give me now, this is off the top. I did not prepare you for this, right, Leah? Give me off the top of your head 3 major fixes that could transform healthcare in the U.S.
Wow. Okay. I mean, there's so many, but this recent article that went out regarding the Federal Trade Commission squashing non-competes. I think that, and this is of course also off the top of my head, there might be some more important things, but if you abolish non-competes, you give doctors leverage and you give them freedom to own their own professional selves. We are the value creators. We don't learn things when we go to hospitals. We create the value. We teach them,
Right, exactly. Hospital at 4 walls, and we need to work with them. But yeah, absolutely. It doesn't run without physicians and nurses and technicians, who, by the way, are all different types of, providers, right? And I know you've been very vocal about letting the public know there is a difference when somebody, goes to, 8 years of school and anywhere from 3 to 8 years of postgraduate education. There is a difference, and that's okay. It doesn't, we need all levels, right? So that was one. What's the second?
The 2 other
What's
ones,
the second
private equity and any non-physician owning any medical practice. What's really interesting is only lawyers are allowed to own law firms. Now, why is that?
Wow. Well,
why is that? Why are only lawyers allowed to own law firms? Because legally, lawyers have a fiduciary to their clients. Well, wait a second. We have a fiduciary to our patients. We have to serve them first and put them first and above profits.
Well, the Hippocratic Oath, right? The Hippocratic Oath.
Exactly.
Anybody hear of that?
So, there's an unfortunate, rule in the ACA that says physicians can't own hospitals. So it's the exact opposite rule that's being placed on us. And in general, like the uneven, enforcement of laws and rules and regulations against physicians. Corporations have way too much power. Third parties have way too much power, including insurance companies. So that would be my third one.
Okay. So let's think of
please.
To give you mine very quickly. One is oversight, not authorization, meaning that we're not imperfect. There should be bodies, whether it be an insurance carrier or a medical board, should oversight, but to stand in the way of each and every decision by this word, which is, I think it's a 4-letter word called authorization. We have to abolish that. Okay. Second one is right clinician at the right time. I think the public doesn't realize the value. There's so much medical knowledge. You got to see the right person, right? That will save a lot of money. That in and of itself will save money and save time, and not to mention, so that's a simple one. And then the last one is this: what we're doing right now, Leah, and thank you for joining me. Educating the public about the challenges we're facing is really going to be key. And I think now there is infrastructure for us to be able to do that in an economic and very broad fashion. Please use hashtag healthcare from the trenches. That's one word, healthcare from the trenches, a long word, which is very descriptive, I think. And then there's these information in my book. But any last words?
I think it's time for us to start realizing that ownership is the future. We need to own the future. When I say there shouldn't be physicians should be allowed to own hospitals, and that we need to own things and nobody should be able to own us. Private equity shouldn't be allowed to buy up doctors' practices and put a downward pressure on our wages. Insurance companies shouldn't be able to put a downward pressure on our reimbursement. It's about ownership. And the only way we can own things is if we choose to own things, to collaborate, to purchase practices together, to own companies that build future technologies like HVAC and Evercred, and to get our heads out of the sand and stop pretending like others are going to take care of us.
Absolutely, yeah, and you've taken some great steps to do that by owning our data and our credentials. That is a huge first step, and it's just a matter of getting this out there. So, those listening who think this is an interesting idea, please share this. And by the way, remember you can watch this recording later, so it will. It's out there, right? As people talk about, it's out in the web. But in this case, I think it's going to be a very good thing. So thank you very much. Next week, I think we're going to have a very interesting guest. Should I announce who it is? A fellow who has had his own podcast for some years. I was honored to be one of the early guests, Scott Sigmund. Hashtag follow the fro. You'll see when you see his appearance. I'm very envious. And Scott Sigmund is an orthopedic surgeon who has been really a leader in bringing awareness to the opioid crisis, which not only has a terrible, obviously humanitarian consequence, but certainly the economic consequence. And that's something we cannot ignore in healthcare. So see all of you next week, 9 a.m. on Fixing Healthcare from the Trenches.